It's Dr. Sheftal again. This is part three of the interview, the long form interviews I've done with Dr. Youngblood, who's a pastor at the First Conservative Baptist Church in Jacksonville, Florida. He's very, very interested in getting some answers on COVID because one of his sons got sick up in Virginia and went into the hospital up there with respiratory symptoms, and they immediately put him on a ventilator and all these other things that were not indicated, and he passed away, which is a tragedy, and it's been very upsetting for the pastor. So he invited me on to answer questions about COVID for himself and for his listening audience on his radio show. So that's what we're doing here, and this is part three. There are 20 parts to this, and again, I'm going to be posting a part, and they're about 20 minutes long each. I'm going to be posting a part every weekday until all 20 episodes have been posted. So it's the kind of thing where there's no pictures here. It's the kind of thing where you can turn it on and listen to it while you're preparing lunch or resting, laying down in the beginning of the afternoon to take a small nap or anything like that. And you don't have to look at the screen. You can hear it very clearly what we're talking about and so forth. Dr. Youngblood is very good at asking questions that the common man who does not have a heavy background in medicine wants to know the answers to. So without further ado, let's get into part three of this interview about COVID from the pastor of the First Conservative Baptist Church, Dr. Youngblood.
And by the way, he'll talk about his book, Sanctioned, the COVID Murders. Sanctioned, the COVID Murders. It's available on Amazon.com. And so let me encourage you, if you're listening, if you want to know, if you're willing to sit down and take some hours in reading, I believe it will be a book that's edifying, challenging, encouraging, and educational for you and for those that's in your family circle that you would like to inform. So ladies and gentlemen, with that being said, I'm delighted again today to have with us an author, professor, researcher, medical doctor. He's a plastic surgeon. I might talk with him about trying to work on me, heart surgeon, and I might get him to work on me before he leaves town. But Dr. Sheftal, thank you for being here. I'll let you take the floor at this point. Just simply, for those that may not have heard you yesterday, give a little thumbnail sketch of your biographical background, what your passions are. Why is this interesting to you? Why is this something that you've devoted so much time and research on? Talk about those things.
Okay, thank you, Dr. Youngblood. Well, I got interested in this. I was in Cambodia at the time because I started a charity there called Operation Kids. And I noticed from the very beginning that what the medical authorities were saying about this thing were either out and out false or self-contradictory. So that got me interested in looking into it. And the more I looked into it, the more errors I found in what they were telling the people, or out and out lies, if you will. For example, they were saying that the infection fatality rate was 4%, and I found a cruise ship called the Diamond Princess, which is a perfect model to determine the infection fatality rate, because when you're on the open seas, no one can come or go.
Right.
So when I did the calculations, I determined that the infection fatality rate was 0.1%. That's 1/40th of what they were saying.
Yes.
Of course, they were interested in scaring people from the very beginning. And they all said I was wrong, and it wasn't until September of 2020 when they admitted that I was right. And when you look back on it, you can see how the disease was a rebranding. In other words, there was no COVID-19 or SARS-2, which I'm going to prove in just a second. It was a rebranding of a number of diseases, most significantly the flu. And guess what the infection fatality rate of the flu is? It's 0.1%. So the evidence started to accumulate immediately that this was a rebranding. And I did that on March 8th of 2020. I figured out the correct infection fatality rate. So today what I want to do is review what we did yesterday, which is the proof that there was no SARS-CoV-2 virus. This is very important because once you know that there's no virus, then all of the other things are completely moot. I mean, if there's no virus, what were we wearing masks for?
Yes.
What were we socially distancing for? What were we being locked down for? None of that was necessary or beneficial in any way, and it was very harmful.
Yes.
So let me jump right into the proof that there was no SARS-2 virus. And I know that shocks a lot of people to hear that.
All right, with that statement, hold your thought for a minute. I believe we have Jimmy holding. Jimmy, go ahead with the question or comment, please.
So, Dr. Youngblood, can you hear me?
Yes, we can. Go ahead.
Okay, terrific. Okay, just keep it up, guys. Wonderful, wonderful show. I got a couple quick things I was going to see if you could touch on, and I'll make it fast. One, I'd like to talk about conspiracy theories and how a wonder drug like ivermectin that I believe had won a Nobel Peace Prize or something, the FDA then called it a horse tranquilizer and turned people off about it.
That's right.
And then I wanted to see if Dr. Sheffield felt like one of the most sinister things that's going on now is this revealed injection nanotech and mRNA thing. And again, you hit it on it about this potentially being able to detoxify. And all of us have family and friends that have taken the vaccine. And pray for them and believe that they're going to be fine and they're going to be protected, as the Lord says in Psalm 91:11. He'll send his angels concerning you to guard you in all your ways. But then also about so the ivermectin, the nano thing, the hospitals that they evidently there was accusations that they may have given things like morphine or insulin in potentially lethal doses, and they had reported no pain when they picked these things up. So a lot of upside down things. And here's something for the listening audience to
Actually, the medicine that was used most commonly when they put people on ventilators was a medicine called midazolam. And the trade name in the United States is Versed. And I know a lot about this medicine because when I do a procedure in the office that requires anesthesia, we give people Versed. Because it has a very short half-life. It's the IV form of I forgot it because I don't use it PO. It's a medicine that helps you fall asleep because it has a short half-life and doesn't make you tired the next day. Oh boy, I've forgotten. It may pop into my head in a minute, but that drug was abused severely, and there's an individual in England who was behind it, and basically they were killing elderly people with it. I mean, there's so many horrible things that were going on, and this person knew about it, and a lot of it was ordered before the pandemic started, which again makes you wonder how much they knew about this before this thing even started. It's kind of like Bill Gates buying shares in the vaccine on August 31st, 2019, and that was more than 3 months before the virus was even discovered. So how did he know to buy shares in the vaccine? I tell you, there's a lot of stuff going on behind the scenes back then that was demonstrated that people knew this was coming, and they had no scientific reason for knowing it was coming. So there was a lot of planning that went into this. Let me say it that way for now. But anyway, the caller also is to be thanked publicly by me. His name is Jim Crunden. He's a wonderful person, and he was instrumental in getting me and the pastor together so that we could do these interviews. And of course, it's been very successful. We've done 20 of them so far. And I'd like to thank Jim again because I've met a wonderful person in Pastor Youngblood. I've met Jim, and it's been great for me. I really appreciate it very much. So let's get on with this part 3 of the long-form interviews with the pastor and myself.
a normal person that doesn't have a lot of PhDs in something can wrap their head around. Just because whether you're a food producer or you're in the medical business or you run a church, because as you know, Dr. Youngblood, Matthew talked about my house should be called the house of prayer, but you're making it a den of robbers. And also in Acts 20, can, I think also among yourself, for I know that they may my departure, savage wolves will come in among you, not sparing the flock. And people
Yeah, that's
will
when
rise
Paul.
up
That's when Paul was leaving the church at Ephesus.
and warning you. But
Yes.
here's the thing to think. This is a hilarious study. Several years ago, I think it's 4 years ago now, my sweet sister-in-law, Mary, said, I'm into this dough bread, and I want to do an experiment. She hung a loaf of bread. I won't call out the name of the bread, but anyway, not a normal loaf of bread off the shelf that anybody would buy and make a peanut butter and jelly sandwich up until recently. And she also had been using sourdough bread. Anyway, she hung it on it. 4 years later, the bread still not moldy or has anything because of the preservatives and the addictive and highly processed qualities of what they put in it. It's still good 4 years later. Now, you and I know that if somebody buys sourdough or makes sourdough, which is more and more popular now, not only are the nutrition values much higher and better for them, but it will go bad rather quickly because it's a living, live, it's the way bread was supposed to be made kind of thing. So in one sense, okay, man has gotten involved and thought they were going to improve things by putting over-processed, bleached flour. That just ought to tell you what you're doing there with nutrition. And then preservatives to make it last. And then we're ingesting and asking God's perfect body, hey, let's see what you can do with all these chemicals. So the docs that aren't saying, hey, your body is a temple, treat it that way, exercise, eat right, drink properly, in moderation, and so forth, what it is, but be conscious of what you put in, and don't trust the people in authorities that say, oh, this over-processed food is great for you. Yes, it's addictive, and it's got high sugar and all these other things, and corn syrup, and seed oils, but that's okay, that won't hurt you.
Jimmy, what you're really saying is buyer beware. Caveat emptor, yeah, absolutely. And that's whether we're eating something or driving something or using it, buyer beware. And by the way, just a little footnote before I let you go, that buyer beware should apply to whether a patient takes a shot or a medication, should be with consent from the patient, not just where a nurse walks in or a doctor walks in, this we're going to do, this we're going to give you, et cetera, et cetera, et cetera. I have made some nurses and doctors pretty upset when the few times I've been in the hospital, they come in with a little cup of pills, and each one I said, what does this do? No, I'm not taking that. What does this do? No, I'm not taking that. And on that occasion, after 5 pills, that morning about 8 o'clock, the nurse took them and just flung them over in the sink and says, okay, bye, and left out of the room. There's a mindset somehow that in the medical profession with most that you're not supposed to tell the patient, just do it, and the patient's supposed to just say yes, and that was the whole protocol for what took place with the COVID-19, and now Dr. Sheftal is saying COVID didn't exist, COVID-19 did not exist, and in his book, Sanctioned, the COVID Murders is a telltale book that every person needs to read and recognize what's in it.
Oh yeah, on page 170, get him to speak about Bill Gates. And the interesting thing about Bill Gates and his former wife, Melinda, and how they treated the vaccines with their children. And I'll get off the phone, and God love you guys. Keep up the great work.
Very simply put, Bill Gates did not allow any member of his family to take the vaccine. That was the bottom line.
Yeah. 100%. Isn't that funny?
Any vaccine,
Yeah.
that's correct.
Any vaccine, not just the SARS-CoV vaccine.
So, Jimmy, thank you so much for your call. I believe we have Blake on the line. Blake, go with your question or comment, please.
Yes, thank you, Pastor. First of all, I wanted to make a comment drawing from Ravi Zacharias, and his comment was that just on a secular level, having a single basis of truth is hugely important, because when it starts, and this is a sort of a foundation of our Constitution, with our rights being given to us by God, it's not a matter of one man's power over another man to determine people's rights. It's given to us by God. So when we take God out of the equation, force and coercion comes into the equation as to what people's rights are.
Absolutely.
Which is, yeah.
Well, Blake, you'll have to admit and recognize that during the apex of COVID, there was a mindset through our government that you have no rights. We're Big Daddy. We're going to tell you what to do. You've got to do it. Line up, take the shot, or else. In fact, right at this very moment, through the Trump administration, there's a remediation of all of the military that was tossed out and are forced to take the vaccination. Their records are being expunged, and they're being remunerated with the dollars that they lost during the course of the time they were put out of the military. I'm thankful we're seeing the wrong being righted, but it will never change the historical, fundamental, foundational damage that it did to America, it did to our Constitution, and to our constitutional liberties as Christians. Go ahead with your question before I let you go.
Well, the other thing, and it's one last comment on that. I had something else I wanted to mention. We have to be like the Israelis, like the Jews. We must never forget.
Yes.
Because forgetting means that it happens again. But just as a reminder for the audience, tonight is the beginning of the Intentional Biblical Citizenship program we have running for 15 weeks at Grace Life Church, which is right across from Walmart on San Jose below 295. It starts at 6:45. We're going to have 9 local speakers. Speakers of consequence, speakers that are recognized names that are involved in conservative issues, to augment the 8 video series that we're doing with Patriot Academy Biblical Citizenship. So there's no cost to anybody. I just ask people to bring pen and paper. They may want to bring a 3-ring binder, because we're going to start giving them out information that they are not getting from the local media about what's going on here. So they are prepared to deal with what's coming along in the next 2 to 3 years, as far as policy, but also as far as who's running for office.
That'd be wonderful. I'm thankful that you brought up that information, and it would be my prayer that in some of the dialogue and discussion by some of the speakers, that they bring in the fact that COVID-19 is not the last time that we're going to have the forced push on some vaccination or some so-called pandemic, and people need to be aware of it. Preachers need to grow a spine and a backbone and stand up, speak up, be heard, and be seen in the pulpits, covering everything from the fact that God created the home, He created government, created the church, and in that order. And we have the right, the responsibility, biblically, the responsibility to speak on any of those issues from the pulpit. So if you have any pastors that need to understand what we need to do, just pray that they'll grow a spine and a backbone, and come out of the closet and out of the bed and do what God's called us to do. But Blake, thank you so much for your call, and God bless you today. Dr. Sheftall, go ahead with your thought.
Those are great points. The points that Jim made in his question were also very, very important.
Yes.
There were a lot of iatrogenic deaths. And iatrogenic means caused by the medical profession, by doctors or the hospitals. As you know, they would not let family members go in to visit their elderly who had gotten this fake disease. Mm-hmm. And those people were treated very poorly. Let me clarify when I say the fake disease and that COVID-19 did not exist. What I'm referring to is, first of all, the SARS-CoV-2 virus, now that definitely did not exist. That was completely made up. But COVID-19 existed in that it was a rebranding of other diseases. There's so many people that basically what happened was COVID-19 was atypical pneumonia. That's what the original problem was when Tedros, the WHO director, came on and said there are 14 cases of atypical pneumonia and they're caused by a novel coronavirus. You probably remember that. And so that's all COVID-19 ever was. It was nothing more and nothing less than atypical pneumonia. That's what I mean when I say the disease did not exist in the way that people are describing it now, like it was some horrible respiratory disease. Because basically they took atypical pneumonia, and I'll tell you what that is in just a second, and gave it a scary name like COVID-19, which simply stands for Corona, C-O, virus, V-I, disease of 2019. That's where the term COVID-19 came from. And it simply is atypical pneumonia. Now, what is atypical pneumonia? Atypical pneumonia is when you go into the hospital with respiratory symptoms, they put you in the hospital for pneumonia, and they don't know what the cause of it is. They know that you've got it, and they don't know what the cause of it is or where you got it from. That's what they tag with the term atypical pneumonia. And that's all COVID ever was. Nothing more, nothing less. And then, of course, when other respiratory diseases came along, like the flu, they just called them COVID also to beef up the numbers and scare everyone into taking the vaccine. That's why the flu numbers in 2019 cases were 38 million, and in 2020, only 1,500. So those were all commandeered and called COVID-19 also. So, there was so much fraud going on. It was amazing. And it was all directed toward trying to get people to take the vaccine. But that's what I mean when I say there was no COVID-19. It was simply a rebranding of other diseases and atypical pneumonia.
Even by the nursing staffs in
Yes.
some of the hospitals, and especially the nursing homes.
Yes.
Because the nurses were subject to the propaganda too, and they were afraid to go in the rooms. And so those people got dehydrated. Some of them starved to death. Some of them got arrhythmias because they were dehydrated and died, caused by the hospital. Okay. Also, they were put on ventilators when it was not necessary. They were given too much Versed to make them relax too much to be put on the ventilators. Some doctors, it is rumored, put people on ventilators so they would not be exhaling into the room where all the nurses and doctors were. So they just put them on the machine so they would exhale into the machine. But of course, ventilators were very destructive.
Yes.
During this. 85% of the people that were on ventilators for more than
14 days.
14 days, that's correct, died. And when we switched them over to high flow oxygen by nasal cannula, 85% survived.
Yes.
So it was a terrible choice of therapy.
Absolutely.
Now, I would like to also address Jim's question about conspiracy theories, but let's do that later, because it was comical that the FDA would tell people in advertisements, believe it or not, of a lady standing next to a horse saying, "Come on, people, you're not a horse, you're not a cow. Stop it." Can you believe the FDA would put out something
Yes.
like that? The FDA was sued by a doctor named Mary Talley Bowden from Houston. And she won the case because the FDA is not allowed to tell doctors how to prescribe medicine. They're only there to approve things for use. They're not allowed to direct doctors. And she won the case. So kudos to Mary.
I'm glad to hear that. Question,
Yeah.
if I could insert just briefly. The CDC had a protocol for COVID-19. Physicians would pull up the screen, scroll down, and they're told this is the prescription. Remdesivir was the major one
Yes.
that they used. Speak about that for just a very brief second.
Yeah, very briefly on remdesivir. Remdesivir was a failed Ebola drug. It's a very, very dangerous medication. And when you are treating people for Ebola, which has a fatality rate of between 50 and 99%, and you remove a drug because it caused more deaths than the disease, you've got a very, very dangerous drug there.
Right.
By the way, for the science people out there that want to know exactly what remdesivir is, it's a nucleotide analog. It incorporates into your RNA and wreaks havoc, and that's how remdesivir works. It's not that important. We just know that it's poisonous. It was used against Ebola, and they had to remove it during the trials because it was killing more people than Ebola was. Now it's been approved in 28-day-old babies. I think I say that in here somewhere, but that's just ridiculous.
And it really pains me to think that for this disease it was totally invented, and I'm going to prove it in just a second because I know a lot of people are going, "Oh, this is some crazy doctor on here talking." I was a physics major at MIT. I take my reputation as a surgeon very seriously, and I'm not going to let myself say anything that I can't prove.
Yes.
So don't worry about that. I will prove that there was no COVID-19 and no SARS-2 coming up shortly.
Good.
But remdesivir should never have been used. There was no efficacy associated with it. And I know this from a personal standpoint because a close friend of mine from high school, who's become even a better friend, who lives in Ponte Vedra here near me, and I guess I won't use his name, but he's a wonderful person. And he did get a severe case of probably what was normally referred to as the flu. But he thought it was COVID-19, like a lot of people would.
That's right.
And he went over to the Mayo Clinic here in Jacksonville, and they took him from the emergency room straight up to a floor bed and put remdesivir in him. And as you know, I was in Cambodia at the time, and it's 12 hours difference because it's exactly halfway around the world, and of course there are 24 time zones in the world.
Correct.
So it was about 3 in the morning when he called me, and I answered the phone half asleep, and he told me that they just put an IV in him and they're dripping remdesivir into him. And I said, refuse the remdesivir and go home. And I'm very glad that I gave him that advice. Because he's alive and well now and doing fine. Now, I don't know if you know this or not, but at some point during the proceedings of all these ridiculous approvals that were coming out of the FDA, they actually approved remdesivir in 28-day-old babies. Can you imagine giving a poison medicine like that failed in treatment of Ebola to a 28-day-old baby? It just, what went on with this was
Also with pregnant women.
right. It's just mind-boggling what went on. So if I could just mention one more thing from Jim's question, which I thought was very germane to all this,
Yes.
and that is he was quoting the Bible nicely, and he said that the body is a temple.
Yes.
And that is so true now that we've become enlightened and understand the what really causes disease. I don't know if you know about the terrain theory versus germ theory controversy. Like, are there organisms that cause disease, like Pasteur and Koch, the German guy, Koch's postulates, told us there was. Now, we found out later that a lot of Pasteur's experiments were fudged, if you will. It was a big controversy. He faked a lot of experiments. He wasn't the person we thought he was when he was alive. But we're running out of time here. And I just want to say that we now know that the germ theory has been debunked. And we knew it from the Spanish flu. And I'll go into that later if we have time today.
Yes.
But I do want to get on to when we cut for the break. After that, I want to get on to the part about proving what I've stated so far about the SARS-2 virus.
Absolutely. Ladies and gentlemen, thank you for joining us. We're going to take the top of the hour news break. Right after the news, we'll continue to face the issues. Hang in there. Don't turn your dials. We'll be right back in just a moment.
This is Let's Face the Issues with Dr. Gene A. Youngblood from First Conservative Baptist Church and Conservative Theological University in Jacksonville, Florida. To learn more, visit conservative.edu.
By the way, that's Roger, the great announcer we have that Dr. Youngblood has over at the First Conservative Baptist Church. He's just a wonderful person also. Gotten to know him well. This is the end of part 3, and part 4 will be posted tomorrow at noon. Please do tune into these parts. Some are better than others. You know, we get into some great discussions sometimes. Other times the callers take up a lot of the time, and that's great. We want people to call in. But this concludes part 3, and thank you very much for listening, and I will see you tomorrow for part 4. Thank you.